This is Dr. Roger Knapp, pediatrician. I'd like to talk to you about circumcision. Fairly controversial, obviously not a necessary operation. But let's talk about the pros and cons and the different kinds. Circumcision, of course, the removal of that foreskin, and studies showed that later on in life with circumcision, there's actually less kidney infections, less venereal diseases, AIDS, gonorrhea, and less cancer. It's not a huge amount, but there's definitely some health benefits. I also personally feel that it's better hygiene and care of the area when they're circumcised. The procedure, we first numb up the area by injecting some lidocaine numbing medicine below the skin, and it makes it fairly numb. There's a little bit of discomfort. They actually cry more from the cold soap we wash them off with when we do the procedure. Then there's two ways to do it. One is with a plastic ring, and the other is with a metal clamp called a gomco or mogan. And that metal clamps clamp off the skin. They leave it on there for a few minutes to fuse the skin together, and they remove it right away. And that raw edge is sore. It's I think personally a porthole for germs to get in there, get infected, and it has a chance of bleeding. The other system that I prefer is a plastic ring or bell. We slide that plastic ring underneath that foreskin and tie a string around it. And where the string compresses the skin is actually where the circumcision takes place. We cut off most of the skin, but it doesn't hurt because it's numb past where that string is tied, and that raw edge has no feeling. So they don't cry all day from that. You don't have to put gauze around it. It's pretty well sealed so the bacteria can't get past it. It can't bleed. The skin will heal, and that string and plastic ring will release on its own roughly about a week, and it's part of the way, eventually loosen the diaper. Then you can put a little bit of ointment around there. But until that little plastic ring comes off, just leave it alone, rinse it with water, and just ignore it. The metal clamp type, where they remove everything right away, then we're going to have you put some gauze or Vaseline around there to try and cut down the irritation from stool and urine. Both systems are absolutely identical as far as long-term. It does not cause trouble. As the baby gets older, the baby gets a lot of pubic fat around that pubic bone area. And actually the penis can actually get sunken down inside the fat tissues. There's a photograph at my website. If there's any question, you can see those. And if you keep pulling the skin back a little bit and so that it doesn't get stuck to the tip, then a lot of that baby fat they lose, and by school age it comes out of that and looks very normal. But parents get kind of upset by 6 months to a year. That plump baby, the penis is sunken down inside there, and it's going to come out of there by school age. So we've had some parents recircumcise them, and it's not necessary. Just give it time, it'll come out of there. But that's not lack of circumcision. They're even suggesting that a lot of third world countries circumcise their babies to cut down AIDS and other diseases too. So that's the gist of my personal opinions on circumcision, and I really mildly recommend it for those reasons. Thank you. This is Dr. Roger Knapp.